Hello and welcome back to Equip with Strength podcast. My name is Marianne Keane. I'm your host, and with me today I have a special guest, and long anticipated guest coming on here is Dr. Jonathan Fass. So Jonathan is a doctor of physical therapy, certified, or board certified in orthopedics. He also was a personal trainer. He's CSCS, ACSM certified exercise physiologist, certified orthopedic manual therapist, and a recent congratulations, Jonathan, for becoming or completing your fellowship in orthopedic manual physical therapy. And it's an honor to have you on. And of course, you're also the title of my husband, so that is obviously the most important one. We are here today to talk, like I said, about pain and injury, but I'm hoping to sort of pick your brain, Jonathan, because you've heard my part one, I guess, interview with Travis Pollan. If any of the listeners haven't gone and listened to that one, you can. You don't have to listen to it in any specific order, but I do think that that's a good one to go listen to. So Jonathan, I think from the get-go, let's sort of lay the foundation, maybe define some terms, and I guess define the angle that we're coming at. So one of the things that I'm always interested to know is, like, how do you even define injury in the first place?
So we'll have to take a backtrack because it's the definition is simple, but I think what happens is we naturally confuse the definition of injury with the experience of pain that we then assume is injury, right? So let me give you, listeners, because there's no reason to know what I do, but my background, my current work, I'm a physical therapist, but I work with almost primarily with patients with very complex pain presentations, and something that I specialize in is literally called complex regional pain syndrome. So my whole day is about that, is about the differentiation between what may be pain and what may be injury. So besides the kind of like normal orthopedic stuff, it really becomes patients that have an exceptional level of pain with little to no presence of tissue damage. And that seems kind of contradictory, may not even make sense to people, but the difference there is means everything. So how to define injury is really some type of tissue insult or damage on or about, right? So if I walk off the curb and I twist my ankle and I sprain it, then I've received some type of damage to the ligaments of the ankle. That, however, may or may not coincide with the experience of pain. And because pain is actually a signal, it's a signal of threat, just like love is a signal of safety and proximity to someone that is meaningful to you and is safe, right? So we experience something that tells us something about our body, but the experience of pain itself is different. It's and this is actually the old definition. They just updated it, but it's real or potential, the experience of real or potential tissue damage or associated with such damage, that is understood to be a biological, psychological, and sociological influence to that experience. So really what that means is I might have damage, but if I experience pain, it may also be because something that I'm doing could lead to damage. And because of that, when we experience pain, by and large, it is not because of damage. It is because, well, if I keep going in this direction, maybe I should pump the brakes or maybe I should do something different. So I think that's very important. It is a signal. It's a signal that should be listened to, but it's information. And if we use that information, then we can operate and move in a way that might be safer and more relevant to continued sustained activity.
I've heard you describe it before like a check engine light.
Right, right. So
It
really
doesn't come on when
that's
you're what doesn't come on when you're out of oil.
right. Right, and that's exactly what it is. And when you think of a check engine light, sure, the car could be broken, but more often than not, it's just that a certain parameter of something working in the car is getting a little low. It's
Mm.
time to take a look at what's going on. Maybe I need to, fill up a level of oil, or something along those lines. But if you think about if in the same way that if pain were only associated with tissue damage, really wouldn't be much use,
Mm.
right? You'd hear a pop and then you'd feel pain and you say, thanks for telling me something I already knew. So just like the check engine light that comes on well before something goes wrong, pain very often comes on well before something is wrong. It really has to do with, if we kind of go a little bit deeper into it, pain is an emergent property, meaning it comes from the nervous system, from the brain itself. It's an experience just like all other experiences, like love and et cetera, et cetera. It emerges from something that occurs millisecond by millisecond, which is our nervous system, our brain, trying to predict the next moment, to
Mm.
predict information that will come to it, to predict the consequences of movement or thought or whatever that is. And so basically, what happens is if I reach out to pick something up and instead I punch myself in the face, well, I didn't predict that, right? That wasn't supposed to happen. So the experience may result in pain because I couldn't predict it. And that means that, well, what if I reach out again?
Mm.
Will I punch myself in the face again? Will I reach appropriately? In other words, pain lives in the error. It lives in the error between what I thought was going to happen and what actually did happen. And through that experience, my system may learn, but pain is experienced in the scenario where tissue damage was the unexpected outcome or the potential if this were to continue to become tissue damage. Like I might have popped myself in the eye once, but if I did it again, I might really hurt myself this time. So I might experience pain to say, don't move, don't do anything. Let's try to
Mm.
figure this out. And that is really where that understanding of pain can be so useful because the experience of pain in my eye certainly may imply that there was damage, but it may also imply that, hey, something went wrong here, and let's learn from that experience so that we don't do that again.
Based on that, like when you're looking at when you get hurt, or say in the context of exercise and
Mm-hmm.
fitness and stuff, when something starts to hurt, are we looking then at not necessarily the hurt, but
Mm-hmm.
looking for what the error, what could have caused the error of just
Right, right.
prediction?
And sometimes it's very easy to figure out, and sometimes it's not. And it's also very much relevant that when we talk about, so I'm squatting in the gym and my knee starts to hurt,
Mm.
whatever. It may have something to do with the way that I'm moving. It may have something to do with the way that I'm sleeping or not sleeping, or the stress that I am experiencing at work, or the stress that I feel of entering the gym because someone I don't like is there. And the way that we feel and the environment leads to changes of our movement. So the movement is one aspect potentially of what may be occurring. So if I experience that, I can first we should heed the type of pain. Is it severe, sharp, significant, right? Or is it something that seems to start to be dull, starts to build up? Is there opportunity to change something that I'm doing? Maybe I need rest, maybe I need to change my foot position, my knee position, or anything like that. Is there something that I can do to get more information? If I move my knees a certain way, lean forward more instead of backwards, and suddenly that pain starts to resolve, I can go, oh, I must have been leaning back too far, or, my knees might have been in a position that I don't like, or maybe I was just moving too stiff. Maybe I should be a little looser, whatever that is. If I can't figure it out, then maybe I need to kind of back away and get some rest and figure out if that continues. And do I need to seek assistance, or is it something that was momentary and transient and just went away from there?
say, for example, so a lot of people will say there's like this, you should seek a proper squat
Mm-hmm.
or a proper form. And this is a lot of what Travis and I were talking about, the idea of there being good form. And what is
Mm-hmm.
that anyway? Say you're in the gym and you're doing your squat and you have a perfect squat by anyone's definition, well, whose definition I don't know, but like,
Right.
maybe one person's definition squat,
Right.
you've got that perfect looking squat, and this day just you start to hurt,
Mm-hmm.
like your knee, then you're changing something, you're veering outside of what would be considered a perfect squat, and you feel better. So a lot of people will say, oh, if you don't squat correctly, you're going to hurt. But if you've been, it's quite possible, in fact, often very possible, that you do hurt even though you're doing everything right.
Mm-hmm.
And
Yeah.
so that sort of leads into, I guess, like the other factors that are involved in uh, why we would hurt.
Yeah, exactly. And so first, like you were saying, I mean, if you're squatting perfectly, congratulations, you're probably the first person in existence because there's no definition. And and you hear information and people talking about like a perfect squat. It's impossible, and it probably has no relevance in real life anyway.
Mm-hmm.
There are ways that we can move that allow us to express force more efficiently, and everyone is different structure, different needs, different mobility, different history of lifting, moving, and what the relevance of that movement is or is not.
Mm-hmm.
So there is no perfect squat. There's only some ways of moving that might be better for one person and some ways of moving that might be better for another. And I am always amazed as a therapist where I really don't teach people how to squat anymore. I let them teach themselves. You
Mm-hmm.
guide them through a path of understanding. Try putting your feet together, try taking them apart, try leaning forward, try leaning backwards, and we explore that movement to see what feels better. And I'm always amazed at the individual where in my head, I'm thinking, okay, so they got to move forward like this, they got to do that,
Mm-hmm.
and that is not what makes them feel better. And these are individuals experiencing pain and having functional difficulty.
Yeah.
So there's always gray area, and the ability to move in multiples of ways is probably more advantageous. Certainly gives us more understanding of our body, and therefore the ability to negotiate external forces, external scenarios, perturbations in stimulus, which is what life is. Life is not a perfect squat over and over again until that's the only way you move. That's probably the worst thing you could do, at least from a movement perspective.
Right. I was thinking about in terms of uh, the idea of functional movements and things that people, and I think a lot of people associate that idea of what's functional with uh, some ancient way of moving when we
Mm-hmm.
were cave people, and that was, the way better somehow than how we move today.
Mm-hmm.
And it actually got me thinking about the idea of, well, aren't we pretty much adapted to the lifestyles that we lead?
Yeah.
And so were they.
Yeah.
So technically speaking, we're neither one is more functional than the other. We're just specific to
Right.
the environment. But if you are taking somebody who, which you work with populations who are not conditioned, they're not
Mm-hmm.
usually. Sometimes they are, but into fitness. But you take a beginner, for example, and you're trying to coach them through. As a trainer, you have all these ideas of what this person should be able to do or
Mm-hmm.
should want to be able to do in the future. But I think we have even discussed this. Like, most people just want to do day to day things, like get
Right.
out of a chair without like either moaning or groaning, and like having to like use a lot of momentum. Get up off the floor is a big one. Like, oh, I'm
Mm-hmm.
so easy to get up off the floor now. Lift children, lift grandchildren.
Right.
And then I think, like, why would, it's not necessary to get somebody to do these full like what we consider full range of movement is superior to, say, a box squat. Like a full
Right.
range squat is somehow better than a box squat. It's not that I
Mhm.
wouldn't teach it if the person couldn't do it or didn't want to or did want to, but what are your thoughts on, I guess, the, I'm trying to think, like, is it sort of like this culture within fitness,
Mm.
or like the that everyone should be able to do full, like, from the floor deadlifts,
Mhm.
you have to do a proper push up and you have to do a full range squat, like, even though I guess we kind of all think, well, it depends on the person, but in reality we still kind of, like, even you in your head, you were like, they're going to do this, they're going to do that, and
Right.
like
Yeah.
you kind of just assume there it's going to look like the textbook at some point. But
Right.
what are your,
It,
like, I don't know, there was no really question there, it's just sort of like a, ra-
well,
a
well, no, no,
ramble.
no. I mean, I think what you're saying is true. I mean, and I guess the question, is like, should they move that way, or should we look for them to do a full squat, or what's the point of doing so? And all that is true. I mean, I think there are some basic concepts that can be true for just about anybody. Move more, that's a good thing. Move in many different ways with security and safety, and the meaning, and by safety I mean balance,
Mm-hmm.
strength, application of force that is efficient. That's all good. But how we define that is again, it's an individual thing. Um, and there are going to be ways that people move, and that movement is relevant, and there are going to be other ways that isn't really relevant to that individual. So I think a lot of times it appears like the training world can sometimes confuse the idea of goals with ideals,
Mm.
right? So if the client's goal is to lose a little weight and get a little stronger and look a little better, or whatever it is that they want to do, all of that is good. And if I can get them to move in many ways, which means through a range of motion that, should be reasonably achievable, great. But forcing issues isn't necessarily, that shouldn't be the goal. Um, it's nice to move more. So if someone has never squatted fully, and there no real reason why they can't, great. That's awesome. They get to have more range of motion and control over new range of motion. But it doesn't have to be the goal. It is only the goal if it's relevant to that person, they're interested in doing so, and there can be an advantage to expressing a full range. But it doesn't really matter if they can't, and it really shouldn't impede on the functional goal of whatever it is they're after. Um, so now you can say, why can't this individual squat fully? And there may be a balance issue. There may be confidence in movement. So those things are relevant too. You're going to improve a person's life, quite frankly, if they have better balance, if they move more, with better control. But those are factors that can influence how you program and train. But there's no such thing as, well, this type of idea of like, if you don't show me this, then you haven't earned the right to do that. Oh, please.
Oh, that,
It's,
yeah, the
yeah.
whole
Yeah. I mean, if that's the case, then
prerequisite.
yeah. Yeah. I mean, there's a lot of talk. I've heard this over and over again about, oh, my surgeon said never to squat. And then, well, how are you supposed to get up off the toilet? And then we turn around and say, but you don't have ankle mobility, so you haven't earned the right to squat. It's the same thing. Like, come on. Like,
Oh, there's so many things. And I think that that's how a lot of people end up feeling, that there's just so many things now I have to be aware of.
mhm,
And this kind of gets back into the pain injury thing, because when exercise becomes so complicated and so detail orientated, that to the point
mhm,
of you end up feeling like you can't vary your movement
right,
beyond, like, your movements become so your movement variability becomes so limited because there's this ideal,
right,
and veering from that becomes threatening,
right,
because the even though it's maybe not always explicitly said, if you do it any other way you're going to get hurt, that's
right.
what's implied.
Hmm.
People take it to mean, oh well, oh, you have to make sure your back stays straight, means, oh, something bad will happen if I bend my back.
Right. And we can bring that back to kind of what we started with. So I briefly mentioned this idea of biological, psychological, sociological influence on how we feel. And pain is absolutely one of those things. Really, what that means is there will be an influence of how I move. There will be an influence of what I believe that movement is in terms of its relevance and importance, or potentially danger. And the social consequences of my movement and the influence of that of greater society. So, for instance, I used to live in Saudi Arabia. I happened to work for Saudi prince, and in that society, showing the bottom of your foot is extremely rude. I mean, people will fight over that. And so the relevance of my movement, if I happen to lift my foot up against, and while someone was looking at me, that could actually be threatening and dangerous to my safety, right? Where here, that's not really much of a thing. So different societies provide rules and understanding of what movement is beyond just the physical movement, beyond just even what I understand of that movement itself. So if we go back now to that idea of, well, if I squat, if I bend my back at all to tie my sneaker, my spine is going to explode. Well, so let's take that and break that down. I bend, my personal trainer tells me every time, don't bend your back, don't bend your back. There can be some relevance to that instruction, and it's not relevant in all times and all places. It might be a good idea in one way and a bad idea in another, right? So there's no, like you're saying, there's no one size fits all rule or understanding. And every individual is certainly going to have a certain amount of difference. We can start from a relative understanding of what will be true for most people, but that individual is still an individual. And if you fail to recognize that, then you're failing that individual. So let's say I bend over to tie my shoe. My trainer has told me repeatedly, don't bend your back. By tying my shoe, I am bending my back. So now my nervous system, when we speak of the prediction of the next movement, it's trying to predict, if I do this, will I be safe? And if my spinal column happens to bend and my system says, wait, now I am under the impression and understanding that bending my spine will do something horrifying, then I may have a reflexive experience of pain, tension of muscles, something to say, get out of here, don't do that. And if that happens, it's become a self-fulfilling prophecy.
Right.
At the same time, we cannot possibly control spinal movement to the level of complete lack of bend, and we shouldn't even be trying that. So it still goes back. I could be standing as tall as my spine never bends, and it may still be moving, and that is recognized by the nervous system. So if I'm trying like hell never to move my spine, and we've seen patients like that. We've all seen patients like that come in like they literally have a rod right up their spine because 20 years ago someone said don't bend your back, and they have kept that as their goal. So what do we have? We have overactive muscular guarding and tension under recovery of tissue because I am constantly in this high threat state. And then I'm hurting myself because of that, because I'm under recovered, which is one of the best predictors of actually experiencing pain. How's your sleep? How's your stress? And what are your thoughts and understanding about pain? Sleep is an action of recovery. If I don't sleep well, I have poor recovery. Stress degrades recovery and the ability to recover. And it may also give me an understanding of what I perceive as threat in that time and place. So I'm adding to it, right? And because of that, and so if I'm moving and it's impossible for me to stop the natural movement of the spine, there's no way for me to stop. But consciously, I think I am, and I keep hurting myself. So I keep trying to tension even more, and it becomes a self-fulfilling type of prophecy.
It's fascinating to me because there's so many cues that trainers give that are in the negative. And I heard a few the other day that were just, to me, I was just like, oh no, like, don't, like, not letting your knee go past your toes. This is
Mm-hmm.
a classic. That there's a right and wrong way. There's one right way to go upstairs, apparently. But
Yeah.
I can I can understand, because I've been in that. But when I'm so far removed from that now,
Mm-hmm.
that hearing that again just makes me cringe, because I remember, as somebody who it tends to be, because one other thing we probably should touch on is, like, when you are maybe the type of personality to catastrophize and get into the details and try to find solutions to things. And another bee in my bonnet is the idea that a lot of people come into fitness believing that they're broken, and then they hear
Mm-hmm.
more about their dysfunctions when they
Mm-hmm.
come into fitness, and it just becomes this confirmation. I need to find all the solutions that are wrong with me, and then that's your journey. That's like
Mm-hmm.
what you end up doing. But it's just, hearing that sort of stuff back in when I was experiencing a lot of these physical pain, and a lot more stiffness as well, because I was afraid of doing more damage.
Mm-hmm.
So maybe we could touch on that. Like, if you have pain, if pain is a signal of threat, and there's no, so like with non-specific low back pain, which is very, very common,
Mm-hmm.
then, well, a lot of people still experience some pain, and become even more afraid, because they think that that is doing more, like wearing things down, or they're doing more
Right.
damage somehow. So
Right.
can you maybe demystify that, maybe, if it's a clearer question to start?
Right. I'll kind of go kind of broad and then get more specific here. But
Mm-hmm.
right now there is what's called a paradigm shift. For those anyone that's not familiar with that concept, the idea is that science progresses. Um, it was proposed. Thomas Kuhn proposed that science progresses by not this long trudge towards truth, and like you can just point from A to B in this historical line, and it's just this constant improvement to more and more accurate science. We operate in what's called paradigms. So there is a paradigm of understanding. Science toils away at the rules of that paradigm.
Mm-hmm.
So we can think of it as like, you know, Newtonian gravity versus Einstein, right? That Newton described the gravitational laws as such, that existed for hundreds of years, and science worked away within that understanding. And then Einstein came along and said, nope, it's a little different, and we got to make some adjustments. And now we exist in this post-Newtonian. It's a difference in description of what is actually occurring and happening. So right now we're in a paradigm shift in health and medicine, and really understanding the experience of the body. Um, Medicine has done absolutely miraculous things. You and I were just talking about that tonight. Like how we went within a year to a vaccine in this horrible, epidemic. Um, so medical sciences does and continues to do amazing things. One area, though, that may need a little bit of adjustment is this experience of pain in orthopedic conditions, because historically, we have understood pain to be tissue damage. It's just the signal of tissue damage. Um, and that was actually proposed by Descartes 400 years ago. So Descartes, I think, therefore I am, one of the great geniuses of all time. And it was a brilliant proposal for back then, where we're still kind of operating under that same understanding. But in truth, in reality, what appears to be the case, at least more accurately at this point, is this idea that it is experience and not the physical damage. So if we understand that, so that is why we'll have people, well, then you must move perfectly, because otherwise some type of damage will occur. When we experience pain like this non-specific low back pain, you'll first start to think about, like, what did I do?
Mm-hmm.
What happened? Um, Ironically, one of the first understandings of pain was exactly that. It was thought to be punishments from gods or demons. So something you did caused your punishment. And we still think of it in those terms.
Mm.
Oh, what did I do? Well, if only I hadn't done something. It's a psychological phenomenon, actually. Um, so if we're looking for that and it's not obvious, right, and step off the curb and hear a pop, then we think that something must have happened over time, wear and tear, that sort of idea.
Mm-hmm.
We might want to get imaging, or a medical practitioner may want imaging. There are very good reasons to get imaging, and there are very poor reasons to get imaging, and it just depends on what the scenario is. The idea of nonspecific back pain is actually that does not have symptoms going down the legs, that has been within, a handful of weeks, actually is not a good reason to get an image. The problem is that if we do get an image, you almost certainly will find something. And the finding has a very poor correlation with that experience of pain.
Mm-hmm.
So by literature, it's actually something like 96, 97% of the time, in the case of nonspecific low back pain, which just came out of nowhere, it has nothing to do with anything found on image. Mm-hmm. It doesn't, and therefore it doesn't mean that the physical state or quality of the spine is completely irrelevant, mm-hmm. but it really, in these situations, doesn't seem to be so relevant. If I fall off a roof while I'm painting, it might be more relevant, right? Mm-hmm. But if I just woke up from a good night's sleep and suddenly my back hurts, it probably is not relevant, especially if I'm not experiencing anything but this kind of, it hurts my back. Mm. And the experience of that may be more of a muscular nature, it may be a sensitivity, it's whatever it is. But the finding of the physical problem may not actually be the thing. So what does that mean? How can that be? Well, we have what's called descending modulation. The idea is that the brain is not a passive receptor of pain. That's what Descartes proposed, and that's not the case. Everything comes from the nervous system. Our experience is an experience of the brain, and it allows us consciously to understand our environment and our internal and external environments. The classic example of optical illusions are proof of this. We think an optical illusion, you think you see something, but it's not really there. It's because our brain is trying to construct, based on the information I'm receiving, this must be what I see. Because in truth, we don't see anything. We receive information and then it's constructed to duplicate what the environment is. And sometimes it can be wrong. And the same thing can happen to us internally as well as externally. So my brain has the ability to basically turn the volume up or down. It has the ability to say, you know what, you just bumped your elbow, but I don't care about that. Turn it down. I'm not going to receive that information. I'm not going to act on it. And then we look and we see a bruise and we go, when did I do that? Right? Mm-hmm. Or in the case of a headache, yes, there could be something very wrong, but most of us just grab a Tylenol and say, I just have a headache. So where's your damage, right? Hopefully nowhere. Hopefully, and that is the common scenario. There's no damage, and thank goodness for that. So just like those two scenarios, that can happen anywhere at any point, and certainly if there's nothing precipitating it. If you ran into the wall and you have a headache, let's make sure there's no real damage. But if I just woke up and had one, chances are, most scenarios, there's not a damage that's causing that.
So when somebody has something that hurts, then there's really, and it's been established that there's no damage, or it's most likely that there's no damage, then doing something, even if it hurts, so I think a lot of people will have things that hurt sometimes and don't know what to do about it in order to do the things they want to do. And this is definitely in your realm, because you help people get back to doing things they want to do. Oftentimes as a trainer, I'll have people say, when I do a kettlebell swing, my low back hurts. Then they're maybe a wee bit worried that they might be doing some harm, or to say, oh, my shoulder hurts when I press overhead, and blah, etc., etc. They don't necessarily have anything going on, but it's sensitive. Something doesn't like that,
right?
And it's very hard to know. I think as well, like from a coach's point of view, like you're worried that you will get the person injured, and
Mhm.
I think that's valid. Like nobody
Oh
wants
yeah.
to feel that, but how do you deal with that? Like I know that
Right.
it's not really, I can't treat pain
Mm-hmm.
as a trainer, and most
Right.
people maybe don't have, either they don't have access or they don't necessarily have time to go and see a physical therapist or something.
Mm-hmm.
But like what's something practical or a way to look at that, or what to do about that?
Right. And that's exactly right, because especially as a trainer, but as a therapist too. I mean, I have tests that I can use. I have things that may may make it more or less likely that a certain tissue damage is present or not. I look at the body through movement, but that movement is what's really important here. As a physical therapist, I don't diagnose pathology. Pathology is medical realm. I diagnose movement. I look at how an individual is moving and how that movement may or may not be relevant to their experience. And that's my advantage. And that's the advantage of a trainer, too. We're, when we talk about pathology, so let's say the image does show some stuff in the spine. Well, it's not going to be, unless that damage is so significant and severe that I literally can't move in any way without producing more damage, continuous, et cetera, et cetera, et cetera, type of stuff. And there are scenarios like that. Really, what's happening is I need the presence of tissue damage or the potential of tissue damage, and then how I move around that damage. So we can think of it, I like to describe it kind of like a pothole in the street, right? If I'm driving down the street and there's a pothole, I don't necessarily have to drive into the pothole, but I might. Or if I'm a good driver and I'm paying attention, I go, oops, and I drive around it, and that pothole is not really an issue.
Mm-hmm.
That is the natural adaptation and the adaptation to movement. So we call it adaptive or maladaptive. If it's maladaptive, then in protection of some type of tissue or movement, or the belief that a certain way of moving will be dangerous, it conflicts with my ability to perform another activity. So I, might believe that if my back bends, I'm going to hurt it. So I may tension the hips in order to reduce the movement of the spine. Problem solved, except then when I walk, I can't both not move my hips and then move my hips.
Mm-hmm.
And that becomes maladaptive. So that tissue becomes guarded, it becomes under recovered, and something hurts. So as a trainer, it's typically not your training nor ability to fix something, quote unquote. I don't
Mm-hmm.
fix anything. I just help people fix themselves, but that's besides the point. But what you can do is explore that motion. Can they move in a different way? Can they squat differently? Can their legs go wider or tighter? What feels better to that person? What feels worse to that person? Let them explore their motion, understand themselves and their bodies and the relevance of their movement to their experience, which is the most incredible thing that you can give to anybody, is to let them realize that, hey, just because it hurts when I, raise my arm doesn't mean I can't go, oh, that feels better if I do it that way.
Mm-hmm.
And to understand that they have control over things that very often sometimes feel like they don't have any control. I just can't overhead press. Well, what that individual is really saying is, at this point in time, I cannot overhead press with a given amount of weight or greater at a given speed in a given range of motion in a position.
Mm-hmm.
There may be other positions, other speeds, and other weights that they can. And if that's the case, fantastic. And if they feel great and nothing hurts them, carry on. And if they can't do that with anything that you've explored, that may be an opportunity to then send them to a therapist, do something where someone whose job is to diagnose that and to say, we'll make this better by one mean or way or another. That's their role to play.
Yeah. It's maybe worth asking you this. When you say you have a thigh press from a position, out here,
Mm-hmm.
and that starts hurting, so then I move like in here, and this is fine, and I'm doing that. I think it's tempting to be afraid of this
Mm-hmm.
because once upon a time I had pain this way. So how, just once in a while, just try that again.
Yeah.
and test
Yeah.
it and just
Yeah.
let it become a demon position
Right.
type of
Right.
thing.
Yeah. I mean, I think what tends to happen, um, and this is true in the literature as well, individuals come to physical therapy because there is a functional problem. It's not specifically pain, at least not for your standard orthopedic, because we all move and sometimes something hurts, and most of the time we'll be like, yeah, whatever. But if
Mm,
I can't go upstairs anymore because my knee just hurts
yeah.
to hell and continues to hurt, that might be a time where I start to think maybe maybe, quote, something is wrong. But what's really happening is what's wrong is that I can't figure out how I can stop this from occurring.
Mm,
So if I have the ability to change my position, and for example, like I rarely, if ever, deadlift from the floor anymore. It just doesn't feel good to me anymore. I'm an old man. It just doesn't feel good anymore. And so I pull from blocks and it feels great. And I don't particularly need to deadlift lots of weight or even a small amount of weight these days um, from the floor. It's just not relevant. But if I can't pick up our daughter, that's relevant now, right?
mm,
So it all just it only matters if it matters. So if I was having, let's say, back pain from pulling from the floor, every once in a while I might try again. I might try at a very light load or unload it entirely, and then maybe take the bar and see if I can do that. And again, I have to ask myself, why am I trying?
mm.
Is the movement relevant, and do I really need to do this, or do I have other ways to accomplish the same task of exercise and whatnot? Because in my daily activities, I feel fine, right?
Right.
So it's just a matter of asking yourself why you want to. And it can be completely legit to say because I want to. Okay. I mean, that's cool, right?
Yeah.
But if I'm otherwise able to accomplish the things I need to accomplish, it's not necessarily bad or good. And very often we just need to back up a little bit and gradually expose ourselves to that stimulus, or change just enough. There are going to be, I can't sprout wings and fly. I don't have the physiology to do so. So if I force myself to do so, I'm probably just going to fall off a roof, right?
Hmm.
So there are things that we may or may not be capable of doing, and most of the time we probably don't need to, and our bodies allow us the opportunity to have variation, and that variation is good and adaptive and necessary. So, again, if I can't bend my knee at all, I can't get up off of a chair, I can't go upstairs, and I've tried to turn my foot in, and I've tried to turn it out, and I've tried to move my hips this way, and I've tried to move them that way, and it's no go, well, then maybe I need to talk to someone. But if I can just change it around, very often what happens is a couple of weeks go by and you're probably okay then.
Yeah. I think it's funny that a lot of what we do to troubleshoot our issues with movement is to try different movements, but it's it's kind of the other factors as well that we often don't look at and address, like my stress, my sleep, my beliefs.
Mm-hmm. Mm-hmm.
So it's worth kind of troubleshooting those things
Oh yeah.
too, as well. It's probably more important to.
They are definitely more important, at least as a general statement. It's fine to look at the way that you're moving, but the presence or absence of stress, lack of sleep, those type of things are universally more relevant more often. Um, so the way that I'm moving may or may not influence that. And it may be that I'm not moving in a certain way, meaning that I'm guarded or locked up or stiff, which can be an influence very much so of a lack of sleep or
Mm-hmm.
the threat that I'm experiencing as a stress of some type. And
Mm-hmm.
that threat can be any number of things. I mean, if I had a nickel for every person that I treated over the course of my career that, had back pain and said, well, the chair at work is horrible,
Mm-hmm.
what kind of chair do you have? Oh, it's a waste of money because I got the most expensive one in
Right.
the catalog, and it's got all this ergonomic stuff, and my back still hurts. But it turns out that they also hate their coworker,
Mm-hmm.
and So when they come in, there's immediately this type of like tension environment. This environment is dangerous. And so my back may tighten up in preparation for fight or flight because of a threatening scenario or situation. If I am tensioned for a long period of time, and when we talk about tension, it's not even necessarily something that is like I'm here and I'm just, so mad. It's generally a very small amount of muscle activity. What's very interesting is they've done research where if they're doing like EMG studies where they're looking for, the noise of muscle activity, basically, there would generally be the case that if there was a few points, if there was just a little bit of noise in research, they would just ignore that as just noise. They wouldn't start counting until it was after like 5%, for instance. A couple of researchers came along and said, well, is that true? And so what they did is they artificially created a certain amount of EMG activity. They had subjects that were completely silent, and then they would use an electrical stimulus to actually start to produce muscle activity. And what they saw is somewhere roughly around 5%, which was imperceptible to the individual. You see range of motion reduce. You see certain orthopedic tests that we perform are now positive instead of negative.
Wow.
Really interesting stuff. And so essentially what appears to be happening is if I'm under the understanding that my environment or something is threatening, and it could be my environment, it could be my dumb coworker that's eyeing for my job, and if I lose my job, I can't provide shelter or feed my child or whatever the threat of that existence is or that experience, then it's almost like when you're sitting at the light and it's about to turn green and you just put your foot on the pedal just a little bit, just to get the engine just to start to go because you want to get out of there fast. That's essentially what the system is doing. It's preparing itself for this natural response of either protection, fetal position, and then where do we hurt? We hurt in our hips, in our back, in our shoulders, which is all a position of maintaining protection or fight or flight. And you see these common positions, and then we come around and say, well, you must sit too long. Right. Or it must be your computer. Well, is it the computer or where the computer is and the environment, and I don't like my job? Or that something else is affecting it. And then when I'm on the computer, because this tissue is already a little bit more active and a little less recovered and my stress is high elsewhere, I become sensitized.
Wow, that's crazy. It's like a drip, drip, drip.
Right.
Like torture device. It's just a drip of water, but over time it builds up and it's... Yeah, because I was thinking when you were saying about the ergonomic chair and stuff, I was thinking like, I wonder if you kind of, it sort of feeds into a person's mindset that they're supposed to have, they're having this comfortable ergonomic chair and then they're like, it's not working. Then it's like on some level you're probably thinking there really must be something wrong with me then if I'm on this perfect chair and I still hurt. It's like, but also that you're probably even more stiff, you're the type of person trying to attain perfect posture. But there's so many factors that go into it. It's really interesting.
So I had the privilege of working with Bill Hartman, who was at least used to be one of the consultants for Men's Health in their articles. And I will never forget something that he told me as a student, that if you look hard enough, you will always find a problem. And no matter how hard you look, you will never find every problem. And we were speaking at that time about just the physical body and the movement. And in truth, it's multiply that by literally 3, and all the worlds that each category can contain. If it's not obvious, then you're not going to find it. So you think, did I do anything? No, didn't really do anything. Am I under a lot of stress? Oh, yeah, I am, because I got that promotion coming. That's good stress, but I'm still stressed about it. Things like that can have significant influence, and typically they're not the things that we think of. And none of this should be misunderstood to say, ignore it. It's information. And if I don't know what that information means, then I should seek out help. But sometimes it's very obvious to realize what is going on And if I am under a significant amount of stress at that time period, maybe I need to back off the weights a little. Maybe I need to dial in better recovery, make sure my nutrition is good, make sure that I'm going into the gym relaxed, a lot of those kinds of things. And it may be, once we start to look at it from that perspective, we find the opportunity to seek health rather than to avoid harm, right? And I preach that to patients constantly, right? We're always looking for, oh no, I shouldn't move this way, I shouldn't squat that way, I shouldn't bend my back, I shouldn't do all these things, rather than thinking, oh God, it feels great to lift, it feels great to move. And if I'm heading towards something that is healthy, almost by definition, I am avoiding something unhealthy. And that's the way that it really works. And that's the only way that it can really work. It is impossible to stop every negative thing that ever happens. So all we have to do is move towards something positive rather than trying to move away from every single negative. The only thing that happens there is we eventually just get cornered. We just avoid until there's nowhere else to move, physically, mentally, emotionally, and then we're locked.
It got me thinking. I was just laughing. There's this episode of Frasier from years ago where he's is it Frasier's learning to ride a bike, and basically he's convinced he can't ride a bike without crashing into something. And so all he's doing is looking for the nearest thing he might crash into, and inevitably does crash into it.
Absolutely.
And like years ago, I used to be paranoid about how I walked. It's funny.
I remember.
So because I had pain for so long, I kind of had like a waddle, or like a penguin walk. So I got really paranoid, which made my walk even stiffer. But if I was walking past anybody, I would be like, don't trip, don't trip, don't trip. And then I would just trip because of course. Great. But if I just said, okay, just look where you're going, I'm going to that location, and just have your eye on where you're going rather than where you don't want to go, then it's so true that it works so much better that when you're seeking health and something positive versus avoiding something that you're afraid of doing. So I think it's probably a good place to kind of wrap up. But if there was any advice or closing wisdom that you would give to people, given what you know of especially the health and fitness world, the tendency to see things in black and white, what would you tell our dear audience?
There is no black and white. There is no right way or wrong way. There are some ways that express force more efficiently. There's some ways that express it less efficiently. So if you're thinking of how am I moving, think about, well, what makes me feel stronger? What seems easier? Move easy, right? Don't, not everything. I think we get bodybuilding probably gave us this idea that everything should be tensioned and flexed.
Yes.
And you know what? If it's a warm up, it shouldn't be heavy. And if it's a 1 rep max, it probably should be heavy. And they shouldn't, and you should be able to find rep ranges in the middle that aren't grinders and can feel good. So you're there to feel good. You're there to be healthy. So look for healthy, look for feeling good. And if you do so, you'll probably stay pretty healthy and you'll probably stay feeling pretty good by and large. Things will happen. We want that experience of pain because it gives us information. There is a very rare condition called a congenital indifference to pain. Those individuals don't feel it, and they don't, unfortunately, they don't live very long by and large, because pain tells us something about the state of our system, our ability to maintain helpful, beneficial, and normal function. And if I don't know about that function, I may get in trouble. So it is not a curse. It's something to understand and try to utilize, just like anything else. We don't run away when, I look at Marianne and I feel loved in my heart. I don't run away from that. So I shouldn't run away either, if I'm feeling some pain in the gym. It just means that something may need to be done. And very often, all that it really is just gotta take a rest or lower some weight or do something different. Don't ignore it. And that's probably it.
Good advice. Well, thank you, Jonathan, for joining me today on the podcast from the other side of the house. And yeah, so people can't find you online now,
No.
right? No, you're not online.
Because I am also moving towards happiness and health, which means
Yes.
to get off of social media.
Yes. I'm trying that myself.
You can
Works.
web search me. My
Web search it.
name will come up. Yeah.
Well, I appreciate it. Thank you very much. And hopefully we'll have you on again in the future.
I don't have much choice. We kind of live in the same house.
Yes, you'll be forced. Okay, everyone. Thanks for tuning in. Bye.